We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the regular trustee meeting, November 23rd.
Your inpatient days were 128 in November compared to 90 in October. But if you look at the inpatient revenue from those 2 months, about a $57,000 difference. And then 1884 office visits in November and 2,000 in October. In those office visits, especially when you get into December and January, I can tell you now, I have not looked at the numbers for December and January, what the total office visits were, but I can almost guarantee you there would be more than October and November, just based on how everything was going here. So it'll be interesting to look at that. The other thing I kind of want to touch on, if you look at salaries, what we've kind of talked about in September, October, November, you can kind of see that starting to come back down. September, October is when we had all the providers incoming and outgoing were still here. And then November October went down a little bit when Paige left, and then when Dr. Galvin left in November, you can see that down. So, in December, January is when you'll should see more of the balance. It'll kind of balance everything out in December, January of what we'll be paying from here on out moving forward. Not so much fluctuation up and down. Same with our operating expenses in October, pretty high compared to November. December and January, I would imagine, would be pretty similar. With so many patients coming in, I can tell you right now, just in COVID tests alone, in December, we send those off to DLO to run those tests. I think our December bill alone was $40,000. So just with so many people coming in and getting tested, it's kind of you can see that hitting on the expense side. The good thing there is in November also, you won't see that in the notes because we've not recognized it as revenue yet. But we did receive phase 4 provider relief funds in November. We received some more in December. There was also a rural ARP funds that we received as well. So between November and December, we received another $600,000, $700,000 in provider relief funds, which is good because that'll help offset the $40,000 DLO bill since those correlate back to COVID tests. Then we can use that there. So that definitely helps us out a lot. But the reason you won't see it in the revenue anywhere in November is because that shows up as a liability initially, and then whenever we actually recognize what we're using that for, then it will show up as revenue later on. So whenever we start using that, you'll see that come through on the financials. The Meditech is one thing that we're kind of hoping that we can use the provider relief funds for. That is something that we have found is an acceptable use of the money. So that would help the hospital a lot, as long as we don't continue to see a lot of other code expenses elsewhere. You're going to have to figure out where to use it. We're hoping to use it for the Meditech. If we don't use it there, then obviously we'll have plenty of code expenses to be able to use it for also. But that's where our goal is right now, to be able to use most of that for this implementation. Because otherwise it would have been a little bit harder to do. But I think it'll be a really good use of the funds. Anybody have any questions from the hospital? Anything?
Yeah, just real quick. I noticed on our bad debt expense that is rising as far as what we're having to write off. Is that a true bridge?
Not necessarily. At the end of the year, we were working. Michelle was working on a big project of. It had been a while since we had gone through a lot of old accounts and just written those accounts off. I mean, we had accounts back from, I think she went back to 2012, and we went all the way through 2018, just trying to go through and pick, a lot of accounts that have been sitting there stagnant for, 9-10 years that they tried to collect on, hadn't heard anything back, and at that point, at 7 years, you're past bad debt anyway. It just had never been written off in the system. So that's the majority of what was happening there. December will probably be pretty similar. We were trying to get that project done by the end of the year, so that we can start fresh in January.
Is anything getting better with True Bridge?
True Bridge was, so we got a new, I can't remember if we talked about this in the last meeting or not, but we had some issues with our project manager. We requested a new manager. They gave us a lady out of Pennsylvania who has been great. She came in, and within the first month, you could tell she was very organized and determined to keep us happy and get everything done that they should be doing. We saw a lot of progress. In the last month and a half, she has been out she had a surgery, her daughter had an issue, and her mom has had an issue. So she has been out for about a month and a half. We have seen that kind of decline since she's been out. And we had a conversation with True Bridge last week, let them know what's going on. They've given us another 2 posters to try to help alleviate some of with so many people, the poster couldn't keep up. So they gave us another poster to try to help with that. And the project manager has been talked to. And we actually talked to Susan, who's our new person, and she thinks that she will be back in the next 3 weeks. So we're kind of in limbo right now.
So you're at the mercy of one employee?
Well, that's what kind of we've seen is that, we have one person that can really motivate the rest of their team. And if they're not motivating them, then they start to really slack off, is what it looks like. We've told our VP about it. We've had enough conversations with them that, in talking with Duncan actually has a billing service too. So, there's always the chance that if this doesn't work out, if we're going through billing with Duncan and Meditech, then it could be something to look at for them also, where they kind of house a lot of our stuff down there. But it's just been an up and down.
We've been with True Bridge for 2 years, and today I can't tell you that we're better off than where we were 2 years ago.
Right.
And so something has to change. They've either got to have marked improvement, or we got to move on. One of the two, in my opinion.
Oh, no,
We've talked about that in finance.
Yep.
Is that something we can cancel at any time, or are we bound for a certain amount of time, or anything?
I think at this point,
I think they know that we've had enough issues with them and talked to their VPs that if we came to them and said we just need out, they would not.
and to their chagrin, this summer we went to them and basically said the team that was working on our project wasn't cutting the mustard, and they gave us a whole new team.
Correct.
They've tried, but for whatever reason, they don't get us, or it just ain't working.
Okay.
No, it hasn't been. Susan came in and we all felt really good. But yeah, you wouldn't think that one person would make that big of a difference, but she apparently does, because they can tell a noticeable difference in when she's there and not there.
But, one of the reasons why we went with somebody like this instead of doing it in-house is because if we had somebody sick or quit or die or retire, we're in that same boat.
Right.
And so this was supposed to help alleviate that, because for years, that's what we tried to do, was do that in-house. And we were always at the mercy of one person, and apparently we're paying money to be at the mercy of one person.
Okay.
Yeah, we feel like we're having to kind of hold their hand and push them along, and we're emailing about issues that we should not be having to email them about. Problems that we're finding that, if we didn't have, Karen and Ashley and everybody here and Jane working in the billing office following up on a lot of these patient accounts, you could imagine how many payments we could be missing or posting issues that are wrong. And, Michelle came in today and found another issue. So it's every day. So yeah, like you said, it's at what point do you say, okay, enough is enough, and you move to something else. I think everybody's a little bit gun shy, because like you said, it's only been 2 years, which is a long time, but also when you go through an implementation, it's not a long time.
Sure.
So you're trying to make sure that it's the right decision before you finally say, all right, I think this is it. So I think we're kind of at the point now where we see if we can get Susan back in here in the next 3 weeks, see what she can do. And I'd say if we're still having issues by the middle of the summer, or even into spring or so, then that'll probably have to be a serious conversation that we would talk about as we're going through a implementation.
What do you think expected time for a patient to get their bill? They come here and whatever is done, what is it? I know you gotta go through insurance.
Right, see, and that's
You know,
it right there. It's all, a lot of it is dictated on the insurance. So if you have Medicare, then you shouldn't have to wait very long at all. I'm trying to think who it was. Group benefit service insurance, if you have them, you could be waiting several weeks before you get a bill. Because when we send out the bills, everything with insurance has to be done before we send out a bill, or else it would just cause mass confusion with everybody. So, add on with the issues that we're finding that's going on with TrueBridge, and that just tacks on more time. But, you know, like I said, Medicare, you should, within a week or two, Medicare's, 2 to 3 weeks, Medicare is paid off and we're fine. Other insurance, Blue Cross, Aetna, and all those, it might take a little bit longer before you
Actually, a lot of
get
those
everything.
insurance companies have people working from home now instead of working in an office.
That has been a large problem. Medicaid has been very hard to get through and talk to because they'll tell you right when you call, I'm the only person. There's somebody there that James talks to. He's literally the only person that does it, and they need 4 or 5, and he's not at the office, so he's waiting for somebody else to scan or email it rather than be able to walk down the hall and get it from them. And I think that's caused a lot of issues that people don't really think about all the time.
Right now, if you look at page 1 of his financials, we're at about 100 days. In a perfect world, you're hoping that would be down around 50, 60 days.
So 2 months.
Yeah.
3 months.
3 months.
Yeah, and we're at 3 plus. But that's not just us. I had to have something done at a different facility over, well, from October, and I haven't got a bill yet. So,
Makes it tough if you can't
Yeah.
collect your money.
Yeah, so that's the other thing. You know, you look at these months where you might have a lot of people that have come in, but you might wait 2 months before you ever get the insurance money or get bills sent out to collect that money. So,
okay. Any other questions? Chris, do you have anything else to add?
not for the hospital.
Okay.
I flip back to the nursing home. And I'll just kind of touch on some of the financials a little bit, let Kelly talk a little more, especially about what's going on now. I mean, with Tony being out and trying to just get through everything. October, November, I had a good month in October. Slight drop in November. They went from 1,244 patient days in October to 1,054 patient days in November. Kelly I'm not sure what happened, or where the discrepancy is in patient days, but Kelly can kind of touch on that. As far as everything else, keeping a tight ship on the operating expenses, making sure that they're not, they did a good job. You look from October to November, a drop of $70,000 in operating expenses. Salaries looking pretty good. It's kind of leveling out. So they're doing pretty good over there as far as keeping their expenses under control with having the loss in patient days. They also received some supplemental money in January from Medicaid. They have not, as far as we know, they haven't received any provider relief funds that we've seen. I don't know if any's going to go in for them. They're with the nursing home. You're just kind of at the mercy of if they send you money or they don't. They don't tell you. It just shows up one day. So I'm not sure if they'll be getting any more or not. But the supplemental payments for Medicaid have helped out a lot, especially in their downtick in November. So just kind of working hard to keep operating expenses under control while we're trying to get through this time.
So it's kind of looking at, when I was looking at their numbers, it's where less is more. And year to date on these numbers, total revenue is down, however, our bottom line is up.
We've had a pretty big focus on expense management. I mean, we haven't spend a lot of money that we didn't need to spend. We have been able to have, several, big ticket items be counted in as COVID expenses, and that's helped. Frankly, when census goes down, we staff accordingly, and we don't use as many supplies, and all that kind of stuff as well. So, of course, we want the census to be up a little bit higher, and a little bit more margin, but we've got big projects coming up, so we need to make sure we've got some money to pay for them.
Any nursing home questions? I know Kelly's working on trying to get everything under control there. Their AP person was out, had a baby, and the other person
8
out.
weeks early.
Yeah, you're right. So Kelly's
I was not prepared.
Kelly's been
Seems to be the thing these days.
wearing multiple hats over there for a while now. So, if you want to flip to the nursing home, they've been doing pretty well.
Homestead.
Sorry, what did I say?
Nursing home.
Sorry, where did that? Homestead. Inpatient revenue, from October, November, like most, kind of had a little bit of a drop. Expenses, right on the money. I mean, you can look at August, September, October, November, they're all within $3,000. So kind of the same thing with the nursing home, making sure that you're watching their expenses, not letting anything get out of control, or having to pay, spreading everything out so you're not getting hit hard in 1 month, especially when you have a drop in revenue like they did in November. So same deal, they showed a little bit of a net income in November, and a larger one in October. So they're doing pretty well up there about managing their salaries, managing their expenses, and keeping everything consistent so you have an idea and you're not afraid for those big upticks or downticks each month. So it's been good. Down a little bit overall in total revenue, but only by a few $1,000s. So any questions?
If not, Chris, thank you. Next item is the Medical Staff Executive Committee. Dr. Burke.
Yep, we met January the 12th, and the minutes of the meeting are included in here. We had one thing that we did, the Medical Staff Credentialing Committee appointed to courtesy staff, Sharisha Warren, Dr. Sharisha Warren. And when I started in September, actually it was August, I came in and got my badge. And while I was getting my badge, Dr. Warren was getting her badge so that she could come and work the clinics. And she's about 7 foot tall and skinny and has fiery red hair. And she's really, really nice gal. And she's from Stinking Creek, Kentucky.
That's really what it's called?
That's really where she's from, Stinking
Wow.
Creek, Kentucky. And she's specializing in vascular surgery. She'll be coming down with the cardiology group. She's in with the cardiology group that comes here twice a month. And she'll be doing consultations. She's specializing in percutaneous surgery to fix peripheral vascular disease, and so that's like stents and things like that. I don't think she does heart surgery. I think she's focusing more on peripheral vascular disease. So that is the end of my report.
And she's gonna do that here,
She's going to do consultations here.
and then
She will not be doing any procedures that I'm aware of, and we don't have the equipment. That'd be in Oklahoma City.
Right.
Yeah.
She'll save some travel and get them in connection with a physician, but they will have to do those procedures down there.
I can tell you as a client on the West End, having Dr. Garner here has saved me a bunch of trips.
Isn't that nice?
To Oklahoma city, so it's a good thing that's going on down there.
I've heard that from others too.
Yeah.
That's a really good thing.
All right, so we do have one item that needs to be for approval, or I guess disapproval, and that would be to appoint to Kersey staff Sharissa Warren, DO.
Make a motion to appoint to Kersey staff Sharissa Warren, DO. Second.
I have a motion by Dr. Hannaford, a second by Dr. Brown, to appoint to Kersey staff Sharissa Warren, DO. Roll call vote, please.
Berg,
Yes.
Simon.
Yes.
Brown,
Yes.
Bowman,
Yes.
Casper,
Yes.
Hannaford.
Yes.
Okay. Anything else, Dr. Berg? All right, thank you. Through QAPI, if you go back to kind of a combination between QAPI and improvement in patient care, if you go back under the patient care tab, there are some contract reviews there that we just need to go over. There's not anything we have to vote on, it's just that we have to view that those are in compliance. Are there any questions in regards to those? If not, the next item that I will jump to is the discussion and action to approve or disapprove the mandatory COVID-19 vaccination policy. You guys remember back in December, we approved a mandatory COVID-19 vaccination policy. Then that was put on hold because the high courts were deliberating whether or not that needed to be done. They came back and had a vote that medical staff, hospitals have to, big corporations don't. And so we fall back under that mandate. So, we have approved before this policy. Is there any questions or discussion in regards to that?
So again, this is one of those things that it is what you have to do. It's a done deal, right?
Yes, if we want to receive Medicare dollars, Medicaid dollars, this is something we have to do. Otherwise, they will not. They'll keep them.
Okay, thank you.
We are a critical access hospital that operates off of Medicare dollars.
What are your dates, your new dates?
March,
February 14th for the first dose of the vaccine, and then it's
March something, March 15th?
something like that.
And is this kind of following the same thing we did last time, where people can apply for exemptions, the same?
Yes. Nothing would change than what we've already approved. We just have to reapprove it because we...
Basically, the dates we're going to change.
Right.
And this is just the hospital.
You'll get a nursing home one at a future meeting.
Yeah.
Did we ever take that one back?
We rescinded it.
You make a motion that we approve the mandatory COVID-19 vaccination policy. Second.
We have a motion by Dr. Brown, a second by Dr. Hannaford to approve the mandatory COVID-19 vaccination policy. Roll call vote, please.
Simon,
Yes.
Brown,
Yes.
Bowman,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Berg.
Yes.
Okay. Next item is the shared convalescent home report.
Chris talked about our decline in census, and between the months of November and December, we did have 4 residents pass away. We also did have a number of skilled nursing patients that were able to go home. I think 2 or 3 of our skilled nursing patients were able to go home. So, combined loss of 7 in the census, and that explains the decrease in revenue over that period of time. With the majority of that occurring in November and not in December. We, like Chris mentioned, we did receive last week about $48,000 as a supplemental payment from DHS. That seems to be how they're supplementing, using their COVID funds, I guess. It's their COVID funds to disseminate, and they're basing those dollars on patient days and sending those out to providers. And we really don't know how long they're going to continue to do that, but it seems like we're getting that about once a quarter. It's coming in handy. Chris did mention, but Tanya Escabel, if I've never said her name in this meeting and expressed my appreciation for her, I'm doing it right now, and I might do it every meeting from now on. But she had to be out of the office unexpectedly and is still on leave, anticipating her to come back next week. But it's been a great learning experience for me, and hopefully everybody's bills are right. And I think we're keeping our bills paid and all of that, so we're, moving right along. Tried to, probably got a few things that I've missed over the last, 8 weeks, 6-8 weeks. So if you hear of anything, just let me know, because I probably did miss something. And I have gotten received a couple phone calls that I messed up a couple bills. So fixing those as I hear about them. But Tanya does a great job for us, and we're looking forward to having her back next week. When we look at cash for January, we're probably going to see a noticeable difference. We didn't bill any Medicaid out until Tanya didn't get Medicaid billed out at the end of December with her leaving, and then by the time I realized we weren't billing Medicaid and we got another plan in place, we're still working out the kinks and probably going to not get any bills out for Medicaid in January, but we'll get the bills out actually this week, and should see payment next week. And if not, we're on top of it with our third-party biller is taking care of that. We already had a third-party biller that billed Medicare Part A and commercial insurance for skilled nursing, and so we just asked them to take on the Medicaid until Tanya came back. So that has been going on. We continue to experience some difficulty with availability issues with supplies, particularly in the kitchen. The things that we were worried about in the beginning of the pandemic, personal protective equipment, all that, we've had, I almost hate to say this, but we haven't had any issues, and we've been able to get those supplies from state warehouses. So we have not had those expenses related to personal protective equipment because the state had purchased so much in the beginning of this pandemic, and we continue to use that as our resource for those type of supplies. But when you talk about things like, the certain types of cuts of meat that we, purchase on a regular basis and things of that nature, we've had to have a lot of substitutions, and they're not always the substitutions that we prefer to have, and they're at a higher cost. We have seen an overall decrease in dietary spending, but that's to be expected because we've seen an overall decrease in census. So that continues to be a concern of mine, but Carson's Food Services is our consultant for dietary, and they are really on top of the supply chain and trying to make sure we don't go without food. And there have been places that have missed trucks completely and not had supplies delivered, and I'm glad that we're not one of those. And I do think Carson's has done a great job of making sure that our suppliers are getting us what we need, or what we ask for, at least an acceptable alternative. So, because we got to feed people. I wanted to point out that since we didn't meet in December, for the November board report, I provided some information on our agency staffing numbers. And since the start of the fiscal year, we have only covered 10 shifts with agency nurse aides. That was our goal, to get down to where we weren't using them at all if possible, and we haven't used them since that November report either. So we're still, as of today, we're still sitting at 10 shifts for the entire fiscal year. And that's been a tremendous savings. If you compare fiscal year 2020, the year-to-date July through November, we had spent $213,000 on agency nurse aides. For fiscal year 21, we dropped that down to $27,000. And for fiscal year 22, that is just almost $2,100. So we have managed to increase our staffing to the point where our direct care cost per patient day is still, staying at a level where we want it to, but more of those people are our people. In fact, all of those people are our people right now, and we can put more people on the schedule for what we pay them versus what we can put on the schedule for what we pay agency. So it's working out very well. Our staffing levels continue to be 4-star with CMS, and our only option to increase our staffing level would be to increase our RN coverage, and it just doesn't make sense for us to have more RNs. And so we're going to, 4-star is our goal, and we're going to, we've been there for quite a while, and we intend to keep it there for our staffing levels. We did also, so we have pay for performance, or it used to be called Focus on Excellence, but it's essentially based on our outcomes. The state of Oklahoma will give $1.25 for every area that we are, per patient day, for every area. They've got 4 areas that they look at. One is pressure ulcers, weight loss, use of antipsychotic medications, and what's on the board? Hold on. The other one is UTIs. And we did get word that we either exceeded the national average or actually exceeded, and most of these would not be what we want to do, but we were below the national average in 3 of these areas, and the other area we saw greater than 5% improvement from the previous quarter, which qualified us for that $1.25 in each of those categories. And when you get all 4 of them, they give you another, I don't know, it comes up to 5 something. Math's hard for me right now. I've been doing too much of that in the office. But anyway, we qualified for 100% of the quality of care payment that we try to get each time. And that doesn't happen for us every time, but I've said all along, if we get the right people in place and we have our core staff and we take care of our people, the outcomes are going to improve. And so we're seeing that. So that's good. I think, unless you guys have any questions about my written report there for either one of those months, that would conclude my report.
Okay, any other questions for Kelly? If not, Kelly, you have an item for discussion.
So, in or around 2006, 2007 maybe.
Each one of you should also have some paperwork in your packet about a van. So,
we received a grant for a wheelchair accessible van. That van has been in service since that time at Share Convalescent Home, and today it's, 16 years old and has 115,000 miles on it, and it has some reliability issues. It's never left us stranded, but there's enough going on with it that I had hoped we would have been able to apply for and receive a grant by this time in the fiscal year, but I still haven't been able to, that application period has not opened yet. I think that just to make sure that when we transport our residents, that we've got a reliable vehicle that will get them to and from where they're going. We need to go ahead and do this. I don't think we should put it off any longer. I did some searches both online as well as talked to the local dealerships, and they don't do wheelchair van conversions. They don't have any on their lots, and so Newbie Vance out of Guthrie is where we purchased the current van that we have, and so I worked with them. I worked with another company out of Tulsa called Mobility One, and then a couple dealerships in the Wichita area I talked to on the phone and discussed their inventory as well. Newbie Vance has a 2019 with 6,000 miles. It's a Dodge Caravan. I did drive it. It drives like you'd expect a vehicle to drive that only has 6,000 miles on it. It drives real well. It does have more capacity for wheelchair passengers than our current van. We can fit 2 wheelchair passengers in this van, and we can also have alongside the driver and another passenger in the front seat if we needed it. Or we can have 4 able passengers and 1 wheelchair passenger. And so it's got more space than what we're used to. Obviously, it's a better quality vehicle than what our old vehicle is right now. For what we need it for, we feel like this is a good price compared to the others that were available, and it's available right now. So that is my recommendation, that the board approve us for the purchase of this vehicle, and I'm happy to. You've got pictures. You've got the window sticker. The window sticker is for the new Dodge Caravan. If you look at the side that has the Newbie Vance letterhead, that tells what they did to the vehicle that's not on the window sticker.
So like this price is the van without the conversion. This is the total price with the conversion after it's finished?
Yes.
Is that what I'm wondering?
Yeah.
Okay. Is that the standard price for conversions? I don't know what that usually.
Neither one of them really told me what their prices were to convert something, but the vehicles that they were selling were all converted.
Okay.
And so I looked at a brand new, actually I didn't look at it, it hadn't been delivered, but a brand new Chrysler Pacifica was $53,000. And so it's the same type of conversion though.
I've done business with them for my daughter, and they're great in customer service and taking care of things. So.
The conversion package that we got, or that this is, does not require a lot of maintenance. It's manual. It's a counterbalanced ramp that our staff can, which is what we have right now. We don't have any automatic anything on our ramp. It is going to be less maintenance than our existing one. We've got a side entry right now. This is a rear entry, but the side entry in and out of those sliding doors is generally going to cause more wear on the vehicle than the lift gate that's in the back of a rear entry like what this is. So, but it
I haven't
is.
seen one of these where it comes in through the rear.
Oh, you haven't? They say and it makes sense there'd be less maintenance issues with
Sure.
it.
Just a parking issue, I guess, in some places.
Well, actually,
Or is it
the
better?
way ours is, if we don't have handicap space with a passenger side, ramp, that's not always available. But we could park this anywhere. It doesn't even have to be in a handicap spot, and we'd still be able to get wheelchairs in and out.
Okay. And you have the funds to take care of this?
We do have the funds to take care of this. We're going to, we have a money market account at Community Bank, and we're going to take the amount of the sale price and use that to purchase the vehicle, and then our plan is to, over the next 10 to 12 months, pay that back into that account.
Okay.
We thought about, Chris and I talked about lease options, we talked about financing options, and we have enough money in that account to not have to worry about this amount of money, and we can just pay it back into that account without any issue.
I'll loan yourself.
Yeah, that's what I told Chris. If I was in my house and if I had the money sitting in savings and I wanted to buy something, I'd buy it out of savings and pay myself back.
Well, then if you do end up getting the grant, then
So we are still going to pursue a grant, and initially when we set the budget up for this year, we wanted to pursue a grant for all 3 locations, nursing home, hospital, and Homestead. I don't know how realistic that is. I don't even know how realistic it is when we apply for it, if we'll get it in the first place for one facility. But if we were to be able to get a grant for the nursing home, we would sell this. It's still, from what I can tell, they maintain their value pretty well, and right now the used car market is pretty good, especially if we're looking in the next 12 months, possibly getting that grant. We would sell this and use the grant money to get a new vehicle.
And you might have said this, but we don't have to worry about the document fee that was on this.
We do have to worry about the document fee. I don't know if that means we need to change the price on the
So the
agenda
rest of
item.
the 43,
Yeah.
381.
And as far as delivery is concerned, if you all approve this evening, they will bring it tomorrow. And Chris, I may need some of your time tomorrow with paperwork. So
They gonna take a trade on your old one?
we're going to hang on to the old one and surplus our old dietary van. We've held on to our old dietary van as a backup. Our wheelchair van right now would make a better backup than that van is, so we'll probably hang on to it. It's not going to bring much money in its condition, but it would work for what we need it for in dietary if we needed to do that.
Would this be available if needed by Homestead or the hospital?
Yeah.
Okay.
We have Homestead and hospital for sure. We've also, in the past, loaned our vehicle to people from the community with proof of insurance and depending on the need.
Any other questions for Kelly in regards to this purchase? If not, I would entertain a motion.
Make a motion that we go ahead and approve the purchase of the 2019 Dodge Caravan wheelchair accessibility van, the price of $43,381.
Second.
I have a motion by Dr. Brown, a second by Mr. Bowman, to approve the purchase of the 2019 Dodge Caravan with a drawn rear entry wheelchair accessibility conversion from Newbie Vance Mobility for the price not to exceed $43,381. Roll call vote, please.
Brown,
Yes.
Bowman,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Burke,
Yes.
Simon.
Yes,
Okay. Kelly, do you have anything extra on the homestead?
On the Homestead or the
Yep.
nursing home?
Homestead, I'm moving on to the
Take your
next.
choice.
Move on to the next. Okay.
Yeah,
Well, thank you for that.
yeah.
As far as the Homestead is concerned, They did have an increase in occupancy from November into December, about 7%, and that's roughly 3-4 residents that moved in between November and December. They did have one discharge for sure, and that was one of my admissions at the nursing home. They've remained pretty steady with staffing. However, in January they do have a position open, or they did have a position open, which we were able to fill with a transfer from the hospital for our resident service coordinator position. They've been working on painting a couple apartments, and I think we need to try to figure out a more cost-effective way to do that. Local contractor that we used this time was more than what we would have typically budgeted for in previous years, and so we need to look at that. We may have something come back before the board regarding that at a later time. The big thing happened yesterday is we did have a plumbing issue. One of the residents accidentally flushed something that shouldn't have been flushed, and so we had water in places where there shouldn't be water. And so we did have to relocate one resident. There are going to be damages, which Carla's already been talking with Angelica at the city about an insurance claim. But the insurance claim would be the city's, but according to our agreement, the repairs would be ours. So that's where that's at. I didn't mention it, but both places have kind of been dealing a little bit more with COVID among the staff, and not just the staff, but their families. So either kids or others that they care for or whatever. It's been a pretty challenging time the last, I'm going to say, 6 weeks. And so hopefully we're going to see a shift back to some good health for a period of time. But I do appreciate, it's probably the same thing at the hospital, but all the staff that, have worked extra and come in on their days off, or, stayed late, come in early, that kind of stuff, just to make sure we have enough people to take care of those that we take care of. So,
All right.
happy to answer any questions about the homestead.
Anything else for Kelly? If not, anything from the foundation?
I do not have anything for the foundation.
Okay. No St. Anthony's report. Next item would be the council report. Greg?
Okay, city council was a pretty short meeting. The pool committee, we have something going on in every committee. We're dealing with people out, old equipment. Biggest part of the council meeting was on the pool we have. The pool committee has, I don't know if you'd call it hired, but they have found an engineer. So we're going to have drawings and a prospectus of the pool probably by next council meeting, I would assume. And other than that, it's pretty routine.
Okay. Any questions for Greg?
If I could add in here, I know that it was an issue for flights out. There was a period of time where the lights were down at the airport. That has been not 100% repaired, but it has been repaired enough that fixed wings can land at our airport again. And there's continuing work with with engineers and to get a permanent solution in place for the runway lighting.
Okay. All right. The one thing, I've got a couple of items in the back of your deal. There is a trustees news, the quarterly trustee news. If you want to take that out, take that with you. There's a few interesting things there. I think we need to lift up the staff here unexpectedly. In fact, it was on the news that we delivered a baby. And don't want to get that out there that that's something we're going to routinely do. But we did, and they stepped up to the occasion just like they have every time that they've had to do that. But that is kudos to them. Then I'm just also going to echo what Kelly was talking about, is the number of people that have had to step up, whether that's physicians, whether that's nurses, whether that's help staff, whatever it may be, because there have been fluctuations of people, and maybe this is the new norm we have to fight through. Lord, I hope not, but kudos for everybody for being there and taking care of the public, and just want to say thank you. There were no other items of new business, so we are,
Just,
well, what?
we're evidently gonna have to have a special meeting. Because our next meeting is February 22nd.
Second.
And
Yep,
that has to happen before the 14th.
Kelly's.
You'll be all right. I'll let you know, but I think it'll be fine.
Okay. Just stay tuned.
All right,
How about that?
that sounds good.
All right, we're adjourned then.